In March 2021, a senior 3 student, Royce Aringa, living in Obaranga village in Kapirabyong district, gave birth to conjoined twins. Unfortunately, one of the twins died before they could be separated. The matter was referred to Mulago National Referral Hospital, who did not attend to the patient.
Actually, we couldn't afford transport. That's how we produced some money for fueling the vehicle to Mulago. We failed.
The desperate Aringa and her relatives returned to Soroti Regional Referral Hospital, where the hospital team, led by Dr. Joseph Epodoi and a team of 15 medical experts, worked to save the surviving child. Indeed, Dr. Epodoi carried out a successful operation that won him national recognition amidst the poor state of the hospital. The Parliament of Uganda, then headed by the Speaker Rebecca Kadaga, invited Dr. Epodoi and his team to Parliament and pledged their support towards the renovation of the dilapidated structures at the hospital.
To know that we still have Ugandans who have a heart for the people. Having failed to operate these children from Mulago Hospital, they were taken back to Soroti and they carried out the operation and it went on successfully. We want to congratulate this team
that we facilitate your good work. You are a pair of gifted hands, which we are proud of. Our very own Ben Carson. I'm sure very soon we shall be performing novel surgeries, which the world will come to hear about.
They pledged to equip the hospital with all the necessary machinery required for the regional referral to serve a population of over 3 million people in Teso sub-region and beyond.
Equip Soroti Hospital that has shown the dedication to start with, but also all other regional referral hospitals with essential medical equipment for specialized care.
I'm going to submit all their names to the National Awards Committee. The medals I can deal with.
Since the pledge, the hospital remains in sorry state, unattended to by government, despite continued reference to the heroic operation by Dr. Epodoi and his team.
Some of the buildings have been condemned, like the medical ward. We don't have any medical ward in Soroti Regional Referral Hospital. We don't have an accident and emergency unit there in that hospital. We don't have an area for isolation. If we get a patient with Ebola now, even COVID, we have to scratch our heads.
For his part, Dr. Epodoi says this regional referral hospital currently lacks sufficient bed space to host its patients, with many sharing beds while the others sleep on the floor.
And this has caused a lot of problems. When you go to the children's ward, you find patients sharing beds, you find patients on the floor, you find patients squeezed, beds squeezed, and we are forced to discharge patients even earlier than when they're supposed to go home.
Dr. Epodoi also reported to the Vice President that the hospital does not have an oxygen plant, which according to him broke down in December last year.
So we don't have oxygen, so we don't have blood.
Due to public outcry, the Vice President Jessica Alupo, who also hails from Teso region, visits Soroti Regional Referral Hospital to ascertain the state of the hospital before expressing concern in the matter.
Because it could have been a national medical store and the supply is very irregular. They don't bring even supplies, medicine.
I know that sometimes government can be financially constrained, but you budget in every financial year, and we shall check why resources up to now for this quarter have not been received by the hospital.
The Vice President Alupo has since advised Soroti University Department of Medical Engineering to start up local innovations and manufacture critical spare parts required in the hospital as they await for further government intervention.
Especially those that require high technology, I request that you have spare parts in the store so that when something breaks down, you replace it.
It remains to be seen if Soroti Regional Referral Hospital, which was constructed in 1926, would be put on the priority list of government institutions due for a total revamp.